Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. As always, we're joined by Dr. Robert Popovian, tuning in from Washington, D.C. He's a pharmacist, he's an economist, and he's the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Connor Mertens from Seattle, Washington, my co-host and our patient advocate and community outreach manager.
And a big thank you to you, our listeners, for tuning in all season. We're a bit sad because this is going to be our last episode of the season, but don't worry, we'll be back in May with a brand new season to give you a full recap on the state legislative sessions and other legislative priorities.
That's right. We're going to make sure that we recap the legislative session sometime in mid-May, and we will release a shorter compilation of episodes so you don't miss us too much. So Connor, let's get right into it. Today, I'm going to ask you what you think of a percentage 80. What does 80% mean to you?
We got our numbers again. 80% sounds like the cost increase I'm paying for my inflated Thai dinners.
Close, but no. 80% is the percentage of retail prescriptions that the three largest PBMs manage in the United States. So the three largest PBMs, Express Scripts, CVS Health, and Optum, manage 80% of the prescriptions in the retail space in the United States.
Well, Robert, it sounds like today we're going to jump in and kind of dive deeper on a topic that we've discussed many times and something that we think is essential to making healthcare better for folks. And that's the issue around transparency. Recently, you co-authored an article in National Review. And I think the title says it all, but it's transparency laws are the first step in creating a more sustainable healthcare system. And like I said, this is nothing new. We've talked about this and it spreads across so many other issues in healthcare, this idea of transparency. And, on the state level, we hear states implementing transparency laws, or at least trying to. Now there's chatter that federal policymakers are interested in passing similar legislation. What can you tell us, Robert?
Well, first and foremost, the reason I authored the paper is because, frankly, if you don't have transparency in the marketplace and you don't have accurate collection of information and data, you're going to make poor policy decisions. So that's what enticed me to write this article, because first and foremost, we need data, appropriate data, and that's going to come through transparency and transparency laws that are passed for us to be able to collect that information and be able to then come up with policy solutions that actually address the data points that we see are not helping out, first and foremost, the patients. So that's what encouraged me to write it. But from a federal standpoint, yes, you're right. I mean, states have dabbled into the issue of transparency for a while. I talked about it in the article that I co-authored with Kathy Wendells. And now federal policymakers are starting to dabble into it and dip their toes into the issue of transparency on the federal level. And both the House and the Senate have sort of sent out smoke signals that they're interested into getting into the space.
I guess the next question is, can you explain to our audience what policymakers are trying to accomplish? We've identified this problem, but what are they doing to solve it?
Well, they're trying to figure out what is the accounting, right? Where is the money going to? So we spend over $500 billion in pharmaceutical spending in the United States. A great percentage of that, over 40%, some people say even closer to 50%, is somewhat given back as revenue to what we call as middlemen, which is primarily 90% of the middlemen. It happens to be the pharmacy benefit managers. So what the federal government wants to do is that of that 40% of that $500 billion that is pushed back into the system, because that's the concessions, rebates, fees that the pharmaceutical industry ends up paying, what percentage of that money is kept by the PBMs as profit? What percentage of that money is passed back to the employers, the patients, and the government, whether it's state or federal? And that's what the policymakers are trying to accomplish, is to get an accounting of almost where's the money flow going. And that's what they're trying to accomplish on the federal level. They've tried to do some of that on the state level.
Yeah, there's a lot of ambiguity and, like we said, just a lack of transparency overall. What would you say is the government stance? What are government agencies saying and doing regarding transparency with these PBMs?
Well, the agencies, first and foremost, the federal government, from a congressional standpoint, both the Senate Finance and the House Ways and Means, as well as other committees within the House, have an interest in looking at this. So that's been their point of view. Let's go into transparency. But it's not just Congress. It's the FTC has also sent out information and requested information regarding transparency. And the reason being is that all of these entities feel that there's incomplete information. So Congressional Budget Office for years has, tried to model how much of the money is being pushed back to the federal government from the PBMs, whether it's primarily in the Medicare Part D space. But what they end up doing is doing it based on modeling data and not actual data. And the actual data that they do receive from the PBM is incomplete data, because what they've done through regulation is they just ask the PBMs to provide them the numbers regarding rebates. But as our audience knows, and we've discussed this many, many times on our podcast, the concessions are more than just rebates, right? We are talking rebates, discount, fees, which have been increasing significantly more than rebates have. And also, remember, back when Medicare Part D was implemented and CBO started collecting this information or mandating this information from the PBMs, we didn't really have specialty medicines, as many of them. And PBMs did not own specialty pharmacies. But in the last 5-6 years, they've acquired a lot of these specialty pharmacies. So not only do the pharmacy benefit management companies, the three largest PBMs, Express Scripts, CVS Health, and Optum, control processing of the prescriptions, 80% of them, that happens in the United States, but they also are involved in the dispensing. So close to 40% of specialty pharmacy dispensing goes through these three large PBMs again, because they own the pharmacies. So not only they manage benefit design, they control, access to medicines through formularies, but now they also manage dispensing. And there's a lot of fees and money that flows through the pharmaceutical industry to these specialty pharmacies, because they require pharmaceutical industry to pay exorbitant fees for them to dispense their medicines from these pharmacies. So the Congress is interested in knowing what is going on, and they want to have a complete picture and not what CBO has for years pointed to as rebates, because as we know now, rebates are an incomplete number of concessions that end up in the hands of the PBMs from the pharmaceutical industry.
Absolutely. And I think something that we've noticed recently, at least anecdotally, is in past advocacy, when we would go to DC and we would work with lawmakers there, it took a lot of time to explain what a PBM is, what step therapy is, all these issues, what are transparency issues. But we've noticed recently that folks are catching on. A lot of the aides in the offices and a lot of the lawmakers themselves, now they actually know what these insidious practices are and what they are. So we're spending a lot less time just trying to explain it and more time trying to fix it, which is a good problem. But I'm curious, who would be opposed to this legislation, and what's their opposition based on?
Well, it's primarily been the pharmacy benefit management companies and the insurers who are opposed to this. Their primary opposition is that any kind of transparency will not allow them to negotiate prices lower or lower pharmacy spending, which is nonsensical argument, because there's ample data that's available in many parts of the marketplace that demonstrates that transparency in fact lowers prices, lowers pharmacy spending, lowers prices of pharmaceuticals. And also, one thing that they don't want to tell policymakers is that one of the largest insurers in this country, which happens to be Kaiser Permanente, which is, by the way, the number one insurer in the state of California, our most populous state in the union, happens to use zero PBM for negotiation of drugs prices. And in addition, they refuse to negotiate based on rebates. They negotiate based on net price. That's all they want to know. What is the net price to me? And they don't care about rebates. And they don't use a PBM to do any of those negotiations. So the model is very successful and successfully lowers prices and costs for Kaiser Permanente. It can be done for the rest of the country. It could basically take us back to where we're negotiating based on net prices. And instead of having these secret rebate dollar amount that flows back, and the fees and everything else, the concessions that flow back to the pharmacy benefit management companies from the pharmaceutical industry, and majority of the time, those dollar amounts don't end up in the hands of the real payers in the United States, which happen to be the patients, first and foremost, employers, and to a certain extent, the government, both state and federal government.
You mentioned successful models, and I'm curious, what is the potential impact on patients when we have these positive models, and what's the impact on patients when we don't have transparency?
Well, the boogeyman argument that PBMs always use regarding transparency, besides their inability then to lower prices and control costs, which we know it's nonsense, is that, well, if you don't collect all these rebates and we go away from rebate contracting to what Kaiser does, which is net price contracting, what you will end up doing is putting pressure on premiums, because they argue that some of these rebate dollars go back to support premiums that lower overall healthcare cost premiums. Again, a nonsensical argument, because if Kaiser Permanente, one of the largest insurers in this country, the largest insurer in the state of California, is able to negotiate based on net prices and they keep their premiums low as anybody else in the marketplace, then what is the point of having this backwards way of doing business? So again, their arguments fall flat because the data doesn't support it. If somebody is paying less for something, then why do you need to increase premiums? Premium support is unnecessary if in fact you're collecting multi-billions of dollars of drug concessions from biopharmaceutical industry and passing on only a percentage of that back to the actual payers.
So I guess the next logical question is, what else can policymakers do, or what are policymakers doing to create this transparency that's obviously needed regarding drug pricing and spending?
So what policymakers should be doing, they're not there yet with regards to the thought process, is another point that we made in the opinion editorial, which is they need to force biopharmaceutical industry to come clean. They need to mandate that biopharmaceutical industry demonstrates or calculates how much price pressure does rebate contracting put on them to increase their prices. We just recently saw, only 2 weeks ago, that Eli Lilly decided to cut their prices. They went down to a net price of $35 for their insulin. Basically, they reduced the price by about 70-80%. Why? Because now no longer they're going to give rebates back to the PBMs. So instead of the PBMs benefiting from this contracting agreements, the patients are going to benefit from it. So the insulin price went up from $120, $130, $140 to $35. That's significant. And that's what Congress needs to do, is put pressure on the biopharmaceutical industry to come clean and demonstrate how much pricing pressure is rebate contracting putting on them. And it's not just rebate contracting, all the fees they have to pay to the specialty pharmacies that are owned by the PBMs that will not cover the medicine unless those fees are paid for. So pharma industry needs to come clean. And also pharma industry needs to start changing their vernacular. For far too long, the industry has protected the PBM business model by referring to them as quote-unquote payers. We've discussed this many, many times again on our podcast. The true payers in this marketplace, in the healthcare marketplace, are not PBMs and they're not insurers. They're middlemen. They pass the money from one side to the other and keep a percentage of it as profit for themselves. The true payers are the patients, the federal and state governments to a certain extent, and the employers. So that's another thing that Congress can do, is really come clean and put pressure on the biopharmaceutical industry to become more transparent about that too.
Well, we're going to make sure you get the last word, Robert, but this conversation of transparency is intertwined with so many of the other conversations that we have. When we're talking about patients and making sure that they have the best benefits and pricing, transparency is the floor. We have to start there, and we can't change the policies and we can't change the legislation until we know where and how this money is moving around. But let's make sure you get the last word. What are you thinking?
No, I'm thinking exactly the same thing you said. Unless we have accurate data, we make poor policy decisions. And the issue of transparency and what Congress is trying to do and what the states have tried to do is, first and foremost, get the information correct. Stop doing modeling work or guesswork, or take the words of the PBMs like CBO has done for many, many years as what percentage they keep. Stop getting incomplete information through laws and regulations that you've written. In fact, get the right information, get all of the information, and then start peeling the onion and making policies that make sense, that actually are going to help patients, instead of making poor policy decisions based on incomplete information or misinformation that you've been doing for many, many years.
Well, as always, thanks for breaking that down for us, Robert. I think there's definitely some valuable information in there for our listeners and hopefully for lawmakers too. And what a great end to the third season. To our listeners, we'll be back in May, so you won't miss us too much. In the meantime, we'll be releasing a few compilation episodes, so make sure you stay tuned in. And don't forget to subscribe to our podcasts on Apple, Spotify, or wherever you might be listening. We've got a bunch of episodes for you to listen to while we're on hiatus, so make sure you catch up on seasons 1 through 3. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your friends and family. It'll help more people like you find us.
Just because we're going on hiatus for a few weeks doesn't mean that we're not going to be checking our emails. So please send us your comments, emails, audio clips, anything that you want us to talk about to healthcarematters@ghlf.org. And we will try to answer all your questions and maybe feature some of those topics in our new season coming up, our season 4, in fact, Connor.
4 seasons, yeah, Robert, time flies. And before you go, make sure you take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of those at ghlf.org/listen. As always, he's Dr. Robert Popovian.
And he's Connor Mertens. We'll see you all in a few weeks.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.